Carol Bailey. I was born and raised here in Miami. My husband and I enjoy the outdoors. We do motorcycle trips. We have an airboat. We do airboating. He goes hunting. We do camping. So we're very outdoorsy and have enjoyed life tremendously. I was having a lot of vertigo issues, and my primary had me do an MRI to double check my inner ear to see if there was anything going on. And they discovered a tumor on my pituitary gland.
So Ms. Carol presented with some episodes of vertigo, which are not very specific for pituitary adenomas. And she also had on and off visual changes.
Pituitary adenomas are one of the most common benign brain tumors. They occur in the skull base where the pituitary gland sits. And they can either be functional, meaning they secrete a hormone, or non-functional. Non-functional adenomas usually present with headache or visual disturbance.
When I first found out it was a tumor, I was a little scared, to say the least. It was more the unknown of what was going to happen and what it could be and what could it become and what could happen to me. And we were going to wait 6 months and see if it was growing. And we had another MRI done 6 months later.
The tumor was overall stable. However, she started to have some more visual symptoms.
I recommended surgical removal, and I said that I would do it with Dr. Seelman, who has experience with using the intraoperative MR.
Both doctors, Seelman and Dr. McDermott, both were very clear with me that it was benign, normally it's benign, and not to worry. And they were both excellent in treating with me and assuring me that everything would be okay.
We decided to take her to the operating room to decompress the optic nerves and remove as much of the tumor as safely possible. We performed these procedures with ENT colleagues. It is kind of a team approach and a very good illustration of a team approach. And in the end of the procedure, we took the patient for an intraoperative MRI. And in fact, the MRI machine comes into the operating room over the patient, and we can perform the scanning right there on the spot without actually interrupting the flow of surgery. And that procedure allows us to visualize the anatomical details as we go. It also helps us to see if there's any residual left behind.
Both the doctors had informed me that I would have the MRI done during this, as soon as the surgery was completed, so that they could ensure that they got it all before we left the operating room. That relieved me a little bit, knowing that they could tell that they got it all before I left there.
In the end, Carol's surgery went very well, as expected. We did not have any intraoperative complications. We did not have any evidence of cerebrospinal fluid leak. We removed the entire tumor, and overall she did very well. We were very pleased with the outcome.
Due to COVID, we've of course limited our outings, but we can't wait to get back to going out and doing the things we enjoy. We do occasionally go out on the motorcycle. That's a clear thing to do. I'm clear from the doctor and everything's great.